Hello everyone out there in this beautiful world. Dr. Mark Pasquale here with more healthy news, some important information for you today on a recall. So Pfizer has recalled a drug called Chantix. In Australia, it's called Champix. I'll actually just show you. I'll just show you what it looks like. So this is it here. It was actually. It's been written up in the Daily Mail. It has made Australian TGA, so I'll just show you that in a minute. But yeah, so Pfizer has recalled its popular anti-smoking drug Chantix. Here in Australia, it's called Champix, after it was found to contain high levels of cancer-causing agents called nitrosamines. So cancer-causing agents called trichosamines. According to a notice posted in the Food and Drug Administration, the FDA, on Thursday, the drug maker is voluntarily recalling all lots of Chantix at the patient level due to the presence of a nitrosamine. And in Australia here, I just want to show you if we can. Let me just show you the TGA here. Oh dear, where are we? Here we go. So this is I looked up the Australian government TGA investigation on it. So consumers and health professionals are advised that the TGA is investigating potential contamination of Varenicline medicines with a nitrosamine impurity. So it's marketed in Australia as Champix, as a prescription medication to assist adults to stop smoking by helping to reduce nicotine cravings and withdrawal symptoms. So the TGA has been advised that very low levels of the substance N-nitrosovarenicline have been detected in Australian Varenicline products. Low or not, they're still cancer-causing agents. So this is something to be aware of, and this is happening with many, many medications all the time. I just bring you this information because it is healthy news. So as a precautionary measure, the sponsor of Champix, Pfizer Australia, has paused global distribution of this product while this issue is investigated. In addition, 2 batches have been recalled from pharmacies that were identified as containing unacceptable levels of the substance. Yeah, so and details can be found on the TGA system for Australian recall actions database. So a couple of things come to mind when we look at this type of information. Firstly, Pfizer. And one of the things that I want to bring to your attention as well is that the dates that we actually look at here is this medication was actually available and has been available in Australia and the world. Let me just stop sharing there. So this medication has been available in Australia and throughout the world as far back as May 2006. Now, what actually happened is the FDA began asking pharmaceutical companies to test their drugs for nitrosamines after high amounts were found in several different kinds of blood pressure medications 3 years ago. So this substance has only been tested for the last 3 years. Last year, the FDA found high levels of nitrosamines in the popular diabetes drug metformin. Now, metformin is widely distributed in Australia as well. That was reported in Bloomberg in 2019. Also Sanofi recalled its heartburn drug Zantac for having high amounts of the carcinogenic ingredients as well. So Zantac has been distributed in Australia too. So I just want to go and look at the Daily Mail once again and just keep that up there on the screen while I just talk about a couple of these things. I don't think I've shared my screen, so I'm going to share once again, and we're just going to go back to the Daily Mail. Yeah, because this is pretty. Look, I wouldn't say it's big news. This is sort of normal news when we start to look at pharmaceuticals. These come across our desk all the time. Most people don't see these unless you go to the TGA website and look these up. You really don't know these types of things are actually happening. Now, so the first issue is that since 2006, these medications have been out there. People have been able to take them, and they're found to possibly cause or have cancer-causing agents in them. So 3 years ago, they start getting tested, and then what actually happens is it states here in the document coming out is that Pfizer first announced it was planning to recall the drug on June 24th after discovering likely carcinogens. So June, so they're thinking about recalling it. Then on July 2nd, it listed a recall of 9 lots So only 9 lots. So from June, then it started taking some lots out in July. Now we're in September now, going into October. Now it's finally been recalled on Thursday, the whole lot of it. So my issue with this is this thing has been out, and people have been taking it, and they haven't necessarily been told to stop. They've just been told to continue taking it, and we'll deal with the consequences down the track. Now, not only that, the company released the lot numbers and urges consumers to check if their prescription is affected. So here it is up to the consumer to check whether what they're taking is actually going to affect them in the future. It is laughable. It's actually ridiculous. So, and then the final piece of the puzzle is the company says, "Oh, look, that's okay," because it released a media statement in July 21 in that people who smoke cigarettes are 15 to 30 times more likely to get lung cancer than people who do not smoke. So the risk of taking a medication like this, which could cause cancer down the track, is okay. Now that's quite interesting, isn't it? So we're actually, and also they state that there is no immediate threat of this medication causing any. There's no immediate threat of this treatment causing any problems. Of course, cancer is never immediate. Cancer is down the track sometime, many, many, many years later. So there you go. So Chantix, Champix in Australia. It's been recalled. Go and see your doctor if you have actually been prescribed it. If you are actually taking it, it is a big issue. So just continue bringing healthy news like this, just to be aware that there are things going on with these types of companies that I question whether they have our interests at heart. If they had consumers' interests at heart, as soon as they were investigated, as soon as they found that there were higher levels than normal, or higher levels that should be able to be used in these cases, they should have actually stopped the use of these medications straight away. They should have taken them off the market straight away. And made sure that consumers weren't going to be affected down the track. So here's some healthy news. I'll put a couple of the links down below. I'll just stop sharing so we can come on. Any questions, please, please do contact me. Please do ask. We're here to help you in any situation possibly we can. Keep out there and keep healthy in these times. And look after your health, because in the end, no one else will but you.